Hello, everyone, and welcome to the Medical Fitness Podcast. I'm Jeff Young, and in this episode, I'll be speaking with a friend and colleague, Sheila Hautbois. The podcast is brought to you by the Medicine, Rehab, and Fitness Institute and JY Kinesiology LLC, both of which are dedicated to medical fitness education and building the bridge between medicine, rehab, and fitness. You can learn more at mrfinstitute.org. The purpose of our podcast is to provide you with principle and evidence-based content on all things related to exercise science, strength and conditioning, medical fitness, and building the bridge between medicine, rehab, and fitness. In this episode, Sheila gives insight into how she goes about discussing lifestyle medicine and exercise with her patients, how she determines which patients are candidates for referral, how she uses her own progressive strength program to plant seeds, intrigue, and motivate patients, and why this is so important in the referral process, how she developed trust in me and also developed trust in the trainers who work with me. She talks about what qualifications she looks for in a trainer, the importance of the vetting process to determine who's qualified, and how she prefers to collaborate. Finally, she discusses why she thinks my virtual medical business model is so important, which is a give people the tools and create informed consumers so they can exercise on their own model instead of the usual entertain to retain clients model that nearly every fitness professional in the industry uses. So let's get started, and I hope you enjoy the conversation. All right. Hey, everyone. Welcome to the next episode of the Medical Fitness Podcast. And I'm very excited to have a friend and colleague join us today. Our other co-host, Dr. Thomas Hammett, will not be here today, but we have Sheila Hautbois, who is a physician assistant, and I have known Sheila for several years. We'll talk a little bit here in the several minutes about how we met, but we have Sheila and I have collaborated on several things together. We've co-authored a textbook chapter, and we've co-presented at some conferences and for her students at Shenandoah University. We're currently working on a continuing medical education course with each other and with Thomas as well, that hopefully will be finished pretty soon. So in any case, with all that said, welcome, Sheila. I'm very excited to have you here on the podcast.
Thank you, Jeff.
So yeah, let's just start off with you telling us about your professional background, what led you to becoming a physician assistant, and you probably should include within that what a physician assistant is for the listeners who aren't familiar with that.
Sure. So I actually had a master's in public health initially and got my certified health education specialist, the CHES certification, right after that, and worked for many years for a local hospital system doing health coaching, corporate wellness, health screenings on site at corporations, lunch and learn seminars, writing health newsletters for the health system. And that was all well and good, except I got a little bit frustrated that so many people, when I was giving them their health screening results or doing a seminar, would ask for advice that was hitting that gray line of, your doctor needs to talk to you about this, your physician, talk to your physician. And honestly, when I was talking about nutrition and exercise and some of these lifestyle type of things, they were like, I've tried to bring this up and my provider doesn't know anything about this type of thing. And that was frustrating. And then a series of events happened where I actually learned about PAs, physician assistants, which we are in the process of changing the name to physician associates. So I'll just use PA throughout the rest of this.
Okay.
I learned about PAs. It's very hard to get into a PA program. It's very intense. It's pretty much like medical school. And I know I'll probably get some flack for saying that, but there's prerequisites that we have to have going in. And then it's a year and a half of pretty much full-time, if not beyond, education, and then a year of clinical rotations after that in a wide variety of clinical settings. So we're trained in the general medical model, just we don't have a residency. So we can have that on-the-job training at whatever specialty or primary care we want to practice in after graduation. So I became a licensed certified PA in order to practice medicine. That was the line that I couldn't cross as a health coach or health educator. And now diagnose, treat, I use medications when necessary, but my top therapy is lifestyle medicine.
It's something else I'm just curious about since you are also an instructor at Shenandoah University in their PA graduate program. Since I'm really involved with Penn State's kinesiology program, and I just know through that exercise science and kinesiology undergraduate programs are a really popular uh, leeway into PAs. And so I'm just curious, since you teach, do you have a general idea of what percentage of your students have undergrads in exercise science or kinesiology or related field?
Yes. So I usually, when we give an exercise related lecture, I usually have them raise their hand or let me know in a chat box how many have undergraduate education in exercise. And I would guess, depending on the class and the year, it's anywhere from 10 to 20% of our class would have
Okay.
that background.
Yeah. Yeah. Part of the reason why I asked is because I've worked in several hospital systems, but I had never, we just didn't have PAs on staff. So you're actually the first PA that I really got to know. And then through knowing you for several years, I've gotten to know, what it means. And I can easily tell, not just through my collaboration with you, but just generally that this is one of the things that makes PA so different is it's just much more holistic uh, and, the inclusion of lifestyle medicine and exercise into the picture. So that's the reason why I asked. But in any case, that's actually a good lead into the next question because I know, since I know you pretty well, at least professionally, that you have a significant interest in lifestyle medicine. And so I'm just curious what led to that? What led to you becoming a member of the American College of Lifestyle Medicine? And the listeners should also know that you chair is it a physician assistant member in this group, or is it a combination of PA and uh, NPs?
Just PAs, right?
Okay,
So we do some cross collaboration and invite the advanced practice nurses to join us on some things because they are part of the nursing member interest group. So that the nurses
gotcha.
include nurses and the advanced practice nurses. So as far as like practice and what we do, we practice similarly. We practice more similarly than they do to nurses. So we include them on some things. But yes, I
Okay.
chair the PA member interest group.
Yeah.
So
Yeah. So
so
what led to your interest in lifestyle medicine and become a member and maybe even use this as an opportunity to talk about what lifestyle medicine is for the listeners who don't know.
we go way back to when I was a teenager and I became very interested in health and the power of nutrition. And I started going to the library because at that time there was no internet, and I was doing
Yeah.
research with stacks and I found a lot of things on nutrition. I can't say that exercise was an area of my research, but it was a part of my life. And so this nutrition piece really became big, and I really dug into research and who was talking about it at the time. There were very few voices talking about the importance of nutrition and the effect on the body and how you could use nutrition for healing. So I got pretty steeped in that, and I ended up taking an internship at a small hospital that had what was called a lifestyle center attached to it. And it was a program where people would go for 3 weeks of transformation, and they used a very healthy diet. They used an exercise program, which included time in nature as well as inside the building with dumbbells and bands and things like that. And they used something called hydrotherapy, which was water therapy, different types of showers or steam baths or different things depending on what the patient's condition was when they came in. And there was one particular story that kind of like really, I experienced it and lived it. And that's what drove me into lifestyle medicine. And that was a man, probably 40s or 50s-year-old white man that was very tall. I remember looking up to him. And he came in with a black foot. One of his feet was black from diabetes. And he had been told that he needed to have that foot amputated. And at that time, he realized, I don't want my foot amputated. By then, it's a little late, right? Like when your foot is completely black. So he was asking around in his community and said, does anyone know any other options? And people were like, no, once your foot's dead, it's dead. And one person told him, if there's anything that could possibly help, it's this lifestyle center. Why don't you try it? So he had come and he was eating the very, very healthy diet. He, of course, was not going on hikes because he came in a wheelchair. But we were doing the bands and the dumbbell exercises and actually some chair aerobics type things. He couldn't bear weight on that foot. And he came to me in the hydrotherapy department I think it was 3 times a day, if I remember correctly. And I would transfer his feet from a bucket of very warm water to a bucket of ice water with ice cubes in it, back and forth for a specific amount of time in each. So that was drawing the circulation to and from his foot. Even though he wasn't able to exercise, we were, making kind of a substitute way to increase the circulation. And over the weeks that he stayed there, I saw with my own eyes the circulation improving in his foot. The blackness was dissipating. It became like a purple and then a blue, brown, green, yellow. And he eventually started to walk again. And when he left weeks later, he stayed more than 3 weeks because we needed more than 3 weeks to reverse this. When he left, it was probably the first and only time I've ever seen a grown man bawling in tears, saying, "You all not only saved my foot, you saved my life." And he said, "I'm going to eat healthy for the rest of my life. I'm an exerciser for the rest of my life. My whole life has changed because of you all and this thing we call lifestyle medicine." When I saw that, and I said, if lifestyle medicine can bring a diabetic dead foot back to life, it can do anything for any chronic disease. Now, not some diseases that can't be fixed with anything, right? Like, I'm not saying it's going to cure brain cancer or pancreatic cancer, birth defects, but any chronic condition, lifestyle medicine is so powerful. So I started Googling, and looking more into this lifestyle medicine. That's how I found the American College of Lifestyle Medicine. I think I connected right around the time I was also getting into PA school to go to the PA program. And I just jumped into the PA member interest group, started helping out, helped the chair and the co-chair at the time, and got really involved. That was probably around 2015.
Yeah, I was just going to ask. So that's interesting because that's right. 2015 is when I got involved. So I actually didn't know. Here I've known you for several years and I didn't know that. 2015 is the year that I got involved with the ACLM. And yeah, that's an amazing story. And look, it's outside of the scope of today's podcast to go back and forth with stories, but man, you just remind me of so many things. I will say quickly that my time at Duke University Medical Center's Diet and Fitness Center, which was my first job out of college, and this was kind of stuff, not with the foot situation, but with the crying and people with with conditions that had really negatively affected their life in one way or another, and then seeing the amazing effects of healthy nutrition, exercise, behavior management, stress management, things like that, and just turning things around. So yeah, I could tell we could go back and forth. Maybe we'll have to have a podcast one of these days where we just give anecdotes and just tell one story. Maybe we'll try to like one up each other. You tell a story and then I'll try to better it, and then you try to better it with me, etc. So in
That
any
sounds
case, so yeah, yeah, yeah. So you and I met through the American College of Lifestyle Medicine, and I was for the first three. Well, actually, I got involved in 2015. In 2017, I was asked to create and chair a fitness and medicine member interest group. I had a 3-year term, so it ended in 2020. But that's how you and I met, because I created a Facebook community because I wanted to have a place where people could come and get into conversations and stuff like that. And you've been very active in that group. But it kind of leads to my next question, which is, how did you get interested in fitness in general? And then let's start talking about, like, with your patients. What are your thoughts on addressing this topic with patients in the clinic?
Well,
The
I was
topic of
fortunate to be
fitness.
a pretty active child, always playing outside, and was a baton twirler as a kid with a team and individually. Learned how to water ski from a friend's parents, learned how to ice skate on a pond from another friend's parent. Played in an adult softball league, I think around college age. So I just liked being active. I liked how it made me feel. And I started learning a lot about the benefits of fitness through reading and studies and being exposed to lifestyle medicine, because initially I had come into it with my nutrition interest. But as I got into it, I realized that it was more than nutrition, right? It included exercise and fitness as well. And I guess that's how I became interested in fitness. I've partly through your Facebook group, I actually have learned more about the benefits and power of fitness. I had my little area, what I thought it was good at, and then I've been expanding on that. And through you talking to my students, I realized that fitness really impacts, or has the ability to impact, every single system of the human body.
Yep.
Stuff we wouldn't even think about. Like the thing that most blew my mind was when you said it affects the gut microbiome. I still remember that day. I was blown away that exercise could affect your gut microbiome.
Yeah.
So hopefully that's news to some people who are listening to us.
Yeah.
The last part of your question was, how do I address exercise with patients? So in the clinic. So I practice in an outpatient setting, not in the hospital. And in an outpatient setting, most of the people coming to me are suffering from chronic conditions that relate to cardiovascular risk factors, hypertension, high cholesterol, type 2 diabetes, obesity, autoimmune diseases that increase inflammation. So all of these are cardiovascular risk factors. And to me, exercise is one of the main pillars to use. Like, it's one of the main tools to use to reduce their cardiovascular risk, along with a healthy diet and some of these other lifestyle medicine pillars. Exercise is a key. And I firmly believe practically every single one of my patients can exercise and should be doing something. And most of them should be doing something more than they are currently doing. And in medicine, we're trained in a model that basically says there's a pill for every ill. And the lifestyle medicine piece brings in the idea that there's also things we can control, right? Because if we just take a medicine, it doesn't really get to the root cause of the problem. It's a Band-Aid in many cases that's suppressing something. But if you forget your medicine, or you get, other side effects, they're not risk-free to take these medications. But I guess exercise is not risk-free either. But if done safely and in a personalized program, it should be close to risk-free, right? And there's so many benefits of exercise that I prioritize talking to every single patient about it. Find out, what are you doing? Ask the questions to assess what kind of exercise they're currently doing. Find out what they've liked in the past, what's been fun for them in the past, and we can start there. And I'm not a believer that everybody needs to start with walking. I can go against the grain in medicine with that. You're going to hear almost every clinician try to tell their patients they should start by walking. And a lot of my patients have breathing problems. So walking is actually really tough for them. The cardio part is tough. But if I can get them sitting in a chair, working with some dumbbells or some exercise bands, that's much easier for them. And they're going to do it. They can also do it while they're watching TV. So yep. I definitely prioritize talking to patients about exercise, because I've seen the benefits of exercise, and I help them to see the benefits of exercise. And that's a reward-based system for me.
Yeah. And maybe because I'm getting ready to ask you the next question, but before I do, it might lead into us talking about um, resistance training or strength training a little bit. And let me just piggyback off something that you just said. With walking, even though it is a good start point for some people, and it depends situation, but it's continuous. And like you said, some people, with whether they're severely deconditioned, or maybe they have some sort of pulmonary condition like COPD or whatever. And then one of the great things about strength training is that it's intermittent. So you can do a set and then you can rest, and you can rest for as long as you feel like you need to rest, and then do your next set. And it's this intermittent exercise that is the return on investment is just astounding. But anyways, I'm going to use that as a way to lead in to the next question. And let me preface it by saying that, as you know, I have launched a virtual medical fitness business. It's still fairly new, still trying to build it. And you have been my primary referral source for this business. So we'll talk about it a little bit, but the first thing I want to know is, can you give some insight into what a patient visit looks like with you, and then how you go about determining if and when you're going to refer them off to me, or actually just, maybe we'll focus on the virtual part, but even just a trainer in general, how do you go about determining if they're the right candidate for this?
Sure. So I address the 6 pillars of lifestyle medicine with each patient. They usually, in almost all cases, have out a questionnaire form that assesses with their beliefs and their actions in each of the 6 areas: nutrition, exercise, stress management, their sleep habits, their social connections, and like a mental health screening and substance use. So I have that information going into a consult with a patient. I know what they've written on the questionnaire survey, and I can see they also make them rate at the end which areas of lifestyle medicine they're most interested in addressing. So if someone's putting exercise up there in their top 2 that they're interested in addressing, then that's definitely going to be talked about in that visit. If it's not in the top 2 or 3, then I still have access to that information, and I can bring it up again at a future visit and find out, if they're any closer to being ready to talk about exercise. Sometimes they want to change other things first, and
Right.
sometimes, they're not in a position to get started with it or talk about it that day, but they might be later on. So it's figuring out kind of what stage they're in, what's their interest level. If they're not currently interested in exercise, I will still usually throw in some information about how exercise could benefit their current conditions, because we want to be giving them that information for someone who's in like a low level stage of change, some information that ties exercise to their current health conditions so they can start pondering it, and maybe they'll become more interested as it goes along. As far as deciding who to refer, I also ask them what they're currently doing, right? So some of them are currently working with a personal trainer at their gym and they're happy. I'm asking, are you happy with your trainer, and are you seeing results? Do you objectively see yourself getting stronger from this personal training that you're doing? Because some people have been working with a personal trainer doing the identical routine for
Yeah.
years, and they'll say, no, no, I'm not getting any stronger, but I'm doing my 3 workouts every week. So then I have the opportunity to talk to them about, well, what is the purpose of your workout? Are you trying to maintain strength? Are you trying to get stronger? What are your goals? And we have a more goal-directed conversation. Some people are currently working with a physical therapist because they have low back pain or a knee issue or something like that. And that's great. I encourage that. And then I also plant a seed that when you're done working with your physical therapist, start thinking about what your plan is for continuing to exercise after that. And we have a little conversation about home exercise programs the physical therapist is going to give them. And what likely happens is they get bored of it after a while, and the need to kind of add on to that after they go home. So that's pretty much how I determine. Well, I pretty much talk to everyone about exercise, and then determine if I need to make a referral, it's because they're not working with a PT or a trainer or have an exercise plan in place. If they need to get started, then I'm going to help determine, do they need to start with PT or do they need to start with an exercise specialist? Who do I know in the community? We also have, at my cardiology practice, we're blessed to have a medical fitness expert who comes in and trains patients in the office there. So I can always introduce him right then and there, if he's in the office, to the patient, say, here's Mike, and Mike's great. And, I'll tie their conditions to what Mike can help them do. So one lady was complaining that she lives by herself, and if she gets down on the floor, she can't get up. So she's very careful not to fall. And I said, exercise training can help you learn to be able to get up off the ground if you are on the ground. And she was like, no, I don't think it can help me. We kind of made a bet, and she started working with the trainer. And after a month, she was able to get up off the ground. That was their first goal, was to get her core and legs and brain trained into what muscles to utilize to get up off the ground.
Yeah, all this stuff is so important. And let's add to this, if you don't mind, that and I don't know how deep we'll be able to get into this, but I have helped you with a strength training program, and kind of entered you into the world of periodization, which Thomas and I have talked about in some previous podcasts and stuff like that. And we're not going to get into a big conversation on periodization, but I'm just curious, how does this play into your conversations with your patients? Just the fact that you've been on, or that you're not have been, you're currently on a aggressive strength training program, and does, yeah, I know that it's kind of a rhetorical question with maybe an obvious answer, but I still want this to be part of today's podcast so that the listeners can understand the importance of you being on your own program, a progressive program, and the role that plays in your conversations with patients.
Yes. So I often tell patients what I'm doing for my personal strength training plan because they're not doing those types of things and they're blown away that it's so easy. For example, I told you, Jeff, I have 2 days a week. That's all the time I have. And you have to help me to do something efficiently in less than an hour each of those 2 days. And when I tell people that I've carved out 2 days a week, it's currently now three, I got to be honest, but that's because I came up to a level of where I was and said, I don't think I can
You
go any further in
progress.
2 days. Yes. But in the beginning, for the first, 2 years, I was able to continue progressing at 2 days a week, which was flabbergasting. So everybody out there's busy. Everybody thinks that you got to work out every single day to gain strength. So I will share what I was doing for 2 days a week and 6 exercises 2 days a week. That blows people away. You only have to do 6 exercises because most people think they got to go to the gym and use 35 different machines and go to a class for an hour and do all these things to build strength. I blow them away when I tell them I did 6 exercises twice a week and continued to see gains 10 times the strength in some things, 12 times in other things. And that really opens people's minds to want to know more about what a progressive strength training program is. So then I take a minute or two and explain how the periodization kind of works in general. And at that point, they either are like, oh, yeah, I know that stuff. Or they'll like, yeah, how do I get a trainer or a fitness person to help me get on a plan like this? And that's when I
Yeah.
refer.
Yeah. I have to tell you, this is just so helpful. Like this is an example of a win-win-win. It's so important for clinicians to understand that, you have to walk the talk. And so, you really should get on a progressive strength training program. I'm going to use this as an opportunity to plug the virtual business that I have because for clinicians listening, you're more than welcome to contact me. I will offer you a free complimentary initial consultation so you can get a better sense of what this is all about. But Sheila is an example. My best referral sources by far over the course of my career. Like it's not even close. The ones who strength train and are on a progressive program, they understand it better and then they get more excited about it and they can advocate more for it with their patients. It makes the conversations with their patients so much easier. And then from my standpoint, I mean, I can't tell you how helpful this is because you've already planted the seed. So when you then refer them to me and connect us through email, you've planted the seed. It helps to bridge that gap with the conversation, and it makes it so much easier for me to start a conversation because you've gotten them excited, and I can clearly see it. You've gotten them excited because of the conversations you're having, which then gets them intrigued and they want to know more. And then then my passion will show when I'm talking with this. So it really is an amazing bridge, and it's an important bridge that I wish it was just very common for not only for all clinicians to be on a properly designed and progressive strength training program, but to also do this with trainers that find trainers, qualified trainers, which I can help people with as well, and collaborate with them because it's the way you develop trust in me too. So you develop trust in me. It just helps with so many different things. And I just wanted to point that out as well. Let's see, before we go into, so the next question is that uh, I want the listeners to understand that as part of my medical fitness model, Sheila refers regularly, but I actually only take on some of the patients that she refers. I have some exercise specialists who work with me and do the majority of the training sessions. And more specifically, they have degree. I don't have anyone work with me performing training sessions unless they have at least a bachelor's degree in exercise science or related field and experience working with special populations. So that's part of my company's business model. But it's a big deal that you developed enough trust in me and the system that I have, which I'm sure some of it is the fact that you've experienced the system yourself, as you just described, that you're okay with the trainers who work with me taking responsibility for training your patients. And the reason why I say that is because during the 10 years that I was in this Mount Sinai system, this was a problem. The physicians, or I shouldn't just say physicians, the clinician referral sources developed trust in me, and then they only wanted to refer their patients to me. And I'm only one person. I can only take so many people on. So from my standpoint, it is a big deal that you developed enough trust in me to so that you're okay with the people that the trainers that I oversee training your patients. So can you talk about that a little bit? Was it a barrier for you early on? Because I actually never asked you that question. And what if it was, or even if it wasn't, what led you to being okay with referring to me, but knowing that I'm actually not going to be the one who trains a lot of your patients? And then we'll also talk maybe about what qualifications you're looking for in an exercise specialist.
Well, I think one thing that really helped us is that we worked professionally together in these groups for a couple of years. So I got to know you. You shared a lot of research and studies and different things in the groups. So I had read a lot about what you talk about all the time, which are classic strength and conditioning studies and principles. And I realized that most of exercise science is classic. It's not, there's nothing like brand new that's coming out. It's, stick to the basics that happened decades ago.
Exactly.
So I got to trust that piece of it. And then just, you had through the pandemic, you hosted I think it was a Wednesday afternoon learning opportunity where PT students, and it was open to anybody, but I think it was a good group of us who came on and discussed case studies, almost like a journal club. We would discuss different exercise science cases and principles. So I got to see all of that and hear from other exercise professionals in those. And I got to present one time too.
Yeah.
But I think, that established our trust. And then in addition, I had to learn to trust you when I had that accident that hurt my back seriously and had some rehab. And I said, I don't think I can, really exercise again the way I used to. And you said, yes, you can. Everybody can. And you basically challenged me to let you help me in a virtual way, which was really scary. But I was impressed how you gave me videos and a lot of information, a lot of good feedback, and would let me ask questions whenever something came up. And I was like, is this normal? Is that normal? Should this hurt? Should this be sore the next day? And we were able to make those kind of adjustments. And one thing you said that stuck with me, which probably isn't directly answering to this question, but I want to share, is you said, Sheila, your pain level that you're telling me, you're going to have some level of pain every day anyways, regardless of whether you exercise or not. That back pain is going to be there. And if you exercise, you said your back pain will decrease because you're going to have endorphins and different things pumping out, and different muscles are going to be sending messages to the brain. So the brain doesn't just have to listen to your lower back screaming every day. And that was true. As I started exercising and ramping that up, my back pain started lessening. And I can honestly say today, I live at about a 1 out of 10 in pain. And sometimes I don't feel it at all. And so that's awesome. And I don't think it's just a matter of time. I think it's a matter that everything else has been strengthened and is able to better support that area. So all that to say that I had already trusted you. And then your question is, well, how do you trust the other people that are working with me? Basically, you introduced them to me as people, one in particular, master's degree level exercise physiologist who you had spent a lot of time with. I believe she shadowed you.
Right.
You were a believer in you had seen her work. You were checking in on her with the first couple of patients to ask what type of plan she was putting them on and make sure that she was following things that you would have done for that patient if you had been training them yourself. So I felt comfortable that you were providing that level of hand-holding with her at first. And then interestingly, I offered to her to come shadow me for a day to learn more about what I'm doing with the patients, what I'm saying, and my philosophies and this whole thing about lifestyle medicine. And she was open to that. And I really appreciated that. So we could all be on the same page working as a team together for my patients. And so that made me feel really good that she cared, was interested in holistic health for my patient, wasn't going to be talking about a bunch of, fad diets or anything crazy that would go against what I was trying to do with the patient overall. And, I think that that has helped me really to trust the other people that work with you.
Yeah, this actually makes me realize that we need to have a podcast sometime in the near future where we just kind of talk about our model and go a little deeper into this because a giant reason why um, well, the reason why I love collaborating with you and you touched on it a little bit here. I don't know if people can tell from listening to you, but you think outside the box and all this stuff creates a model that I think that people should be aware of. You could actually create a list like the fact that you that we collaborated with each other on different things to get to know each other. Like these are all this is all actually part of the disconnect between medicine and fitness, but we connect together. And so all these things can be turned into a list of how you should actually develop trust in the person. So you allowed me to put you on a program and you have been on a strength and conditioning progressive program and saw the benefits of it. And you allowed Elise to come in and do a virtual. This is thinking outside the box that more clinicians should do. So again, we'll save this for a future episode, but yeah, this is great, and it's the reason why a huge reason for the lack of referrals from clinicians to fitness professionals, and it's justified, is a lack of trust. But there are ways to develop trust, and Sheila just hit on some of them, but it's definitely making me realize in the moment that we are going to hold a podcast in the near future where that will be the theme of the podcast, and we'll start talking about all kinds of different ways that we can help bridge this gap. Um,
So
but in
I,
any
I,
cases,
I didn't
I'm sorry, go ahead.
I didn't answer your last part of the question, which was about the
Oh,
qualifications that I'm looking for in
yes.
a specialist. Forgot about that. But before
Yeah.
I answer that, I wanted to say too that part of what allows me to trust you guys and your model is that you guys are not in it to profit from patients that have to continually see you multiple days a week versus someone over there in the box gym that just wants the continuous paycheck. Your model is set up as a teach a guy to fish and he'll be able to fish forever instead of
Yep.
sell the guy fish 2 times a week or 3 times a week. And
Yep.
I really appreciate that you're out there to give people the tools and the understanding that they can do this on their own. That is often a key piece of what my patients need. They need to see that they can take charge of their health on their own and that they have power and they can and this permeates into other areas. They then start taking charge of their eating habits because they're on a strength training plan, and you think, well, how is that possible? But they start thinking, if I'm going to build muscle and strength, I need to be eating right. So then, their self-efficacy goes up because they're on a program that allows them a lot of the responsibility for it. And that's another thing I appreciate about your model or our model.
Yeah.
I don't know if you want to say about anything about that before I answer with the medical
Yeah,
qualifications that
yeah.
I.
Let me respond real quick. So yeah, you actually hit on something that again in the future podcast I want to talk about in a little bit more depth because I realized during my 10 years in this Mount Sinai system, and it's actually the reason why I even created this business model, that most patients, and when I say most, I'm talking about 95% of patients who were referred to me, weren't looking for something long term. They just wanted to know how to get started off on the right foot on a program that takes their medical and or musculoskeletal conditions into consideration to learn proper form so that they can then to teach them how to fish, just like you said, so that they can then do it themselves. And I thought to myself, and you kind of hit on it, the health club world, and I'm painting a broad brush here, so I might get some tomatoes thrown at me through the screen here for saying this, but it's just the truth. A lot of the health club industry is built around um, entertain your clients so that you can retain them and keep them for as long as you possibly can so that the facility can make money. And it's a major problem. And so I'm literally doing the polar opposite, like you just said. I realize that if we could gain the trust of clinicians so that clinicians would then have a steady stream of referrals and just teach most of the clients how to fish, then we, from a trainer standpoint, we wouldn't have to worry about trying to entertain them to keep them for a long time. Instead, we put them on a properly like a exercise science based, a rehab based, a medical, concepts, guidelines based program that is not some entertainment program. And we wouldn't have to worry about where our next client's coming from because we'd have the regular referral. So that's something else that happened with me in the Mount Sinai system is um, I realized that wait, most of these patients who are being referred to me are only purchasing 10 sessions, 15, 20, maybe 30 at the most, and then they're gone. But I didn't have to worry about it because we had a bunch of healthcare providers there. So I was always I'd only be without a client for a week or two, and then here comes the next one. And so this is actually a system. And if we could just get trainers aren't going to get the trust of clinicians to refer if all they're doing is just the latest fads and gimmicks and just entertaining their clients. So it's another reason why I created this model. And I really appreciate that you said what you said because it allowed me to piggyback off of it and get the listeners to understand the importance of this. So yeah, so with that said, what qualifications do you look for in an exercise specialist?
Well, I definitely appreciate the degree in exercise science or kinesiology or something related. I feel like that means to me in most cases the person has had some anatomy, physiology, and more understanding of the human body and the joints and things like that. So from a medical perspective, that's something I'm definitely interested in. I also want to know that they have some understanding of strength and conditioning principles. So either a CSCS certification or some kind of certified exercise physiologist, something like that is really nice to see because I know that. Or if it's someone and you've said, they're qualified, they have this, I trust that too. On top of all of that, I like someone who has a little bit of an understanding of motivational interviewing. So I know they're going to also be helping as a team, me and my patient, to move forward with their health. I'm not just referring so that you can have a client. I'm referring so my patient gets better, and I know that the power of this, that they can get better with exercise. So, but I like to have a teammate in that who's using motivational interviewing and some health coaching principles, even unofficially. Now, how do I find out if they have that? That's part of what I'm trusting you to do too, as you bring on new people, is have those conversations with people. And, I've gotten to know Elise and I know she has that. So an experience with a variety of chronic medical conditions, these lifestyle type of conditions, high blood pressure, cholesterol, diabetes, obesity, comfort with working with a variety of MSK issues. If I send you someone and I say they have a bad left knee, that I feel confident you're going to work around that and not cause an increased problem with their knee. And the last thing that I'm looking for that isn't really a technical qualification, but it's very important to me is good communication and a commitment to that, a commitment to hearing me with things I share about the patient ahead of time, like their bad knee, and also coming back to me and saying, hey, such and, I've noticed their blood pressure, they say it's worse the afternoon after their exercise session. Do you have any input on this? Or just so it's a two-way street conversation. So again, we're teaming up to help the patient get better. And I don't expect that conversation to happen after every session or anything crazy like that, but just like on an as needed basis.
Yeah. Yeah, it's kind of ironic that just this morning I posted that table from the United States Registry of Exercise Professionals on this. They call it an exercise intervention algorithm. And for those not listening to this podcast via YouTube, just know that I'm actually going to uh, do a quick share of this table uh, on the YouTube channel if you want to check it out. But I saw your response in the one group that I posted in, but I'm not going to go over this in any real detail. But the gist of what they did, this algorithm, is to separate qualifications into three categories: high level, medium level, and low level. And the common denominator at the low level was the people who didn't have a degree. And then as you move up the totem pole to medium level. In some cases, it was bachelor's. In some cases, it was master's. But they'd say like strength and conditioning coach, personal trainer, exercise physiologist, Pilates teacher, etc., with either a master's or a bachelor's. And at the high level, it was physical therapist, athletic trainer, clinical exercise physiologist, registered kinesiotherapist, and a medical exercise specialist. But common denominator was they all had degrees, and the majority had graduate level degrees. But it was pretty obvious that whoever created this, or the team that created this table, was seeing things mostly through a clinical perspective. And I posted this on my timeline on Facebook and in about 3 different groups. And so far, the most of the commentary on it has been negative. And you said the general concept is nice as a guide, but this particular chart is too confusing to be useful to me as a clinician. Certain titles are listed multiple times, sometimes in the same category. "Quote unquote personal trainer" is not a standardized title. I'd want to know exactly what kind of degree or training do they have. I'd also suggest that some strength and conditioning specialists could probably be in the high setting. Anyhow, I don't find this chart super helpful. And the reason why I bring this up is because the fitness world and all these different title, nomenclature used for the same or almost the same thing, it's just different settings, different degrees, different titles, etc. It creates a big gray area. Like, this is the way I view it. The fitness field is gray. It's about as gray as it can get. And when you take something like this and you try to make gray black and white, you're causing a problem. And you're actually just going to create maybe a little bit more confusion. But the main reason why I bring this up is because kind of what you alluded to, and what I'm alluding to here as well, is you can talk about these titles and degrees and uh, settings you've worked in and this table that I just mentioned all you want. But ultimately, you need to know how to vet. It comes to the vetting process. What's your job description? What are the things that you're looking for? And then also just becoming an informed consumer from a clinician standpoint and knowing how to vet and what questions to ask and how to dig a little deeper so that because as we all know, there are people with terminal degrees who are not real good at what they do, and there's people with terminal degrees who are amazing. And you can keep going down the chart: master's degrees, undergrad, no degree. So the vetting process is so incredibly important. And I have a podcast on that, and it's something I'm also willing to help people out with. If that's something you want to know more about, I'm happy to help with the vetting process. But you're exactly right. That's really what it comes down to: is understanding how to vet in order to know to really help that trust level, and then ultimately to be able to refer um, your patients. So in any cases, we wind this up. A couple more questions. One is, if you were to giving advice to anyone who wants to make this type of interprofessional connection, whether it be a clinician or a fitness professional, what would you recommend as the key to success?
So I'm going to say the key to success is probably establishing a training relationship. The fitness professional offering to do a couple training sessions with the clinician. You can talk a lot during 1 or 2 training sessions and get to know somebody's philosophy and whether you think they're going to work well with your patients or not.
That's great.
And I'd say that you, Jeff, can help clinicians across the whole country to connect with a qualified fitness professional in their area. And that fitness professionals who may be listening to this should be initiating connections with us, with clinicians in the local area, by offering to support us and our patients. Even if you don't want to train us, at least offer to come in and do a seminar on, starting to exercise with our patients. There's a win-win-win scenario with something we can talk about in another podcast episode on shared medical appointments. So we can have a shared medical appointment, invite multiple patients, bring an exercise professional in, have them talk about the benefits of exercise on, medical conditions. And we can bill for a visit for each of the patients that are there. And, that way the exercise professional is getting to know us and our patients, and we're getting to know the exercise professional more. So it's just a lot of ways we can collaborate in the community.
Yeah. to the listeners, if you can't tell already, Sheila is amazing. And the combination of Sheila and Thomas and me being able to collaborate with both of them, we have a lot that we are can and will continue to say through this podcast and through website medical MRF Institute website that the three of us are cleaning up and building out, and we'll continue to. It's a big project that we have, hopefully, for many, many years to come to make this a place that you can all go to get educated. And Sheila and I just launched a support group on Facebook that I'll put in the show notes as well as a way to potentially connect or whatever. But the point is that we can help. She really knows how to um, think outside the box and is just very different and understands the importance of this medicine to fitness bridge. And obviously, Thomas does as well. So, Sheila, as we wrap this up, is there anything else you wanted to share with what you're doing with the audience, share with the audience about what you're doing or how the listeners can connect with you?
Well, I think we've mentioned most things that I'm working on. I'm working on the CME continuing education with you and Thomas that we'll
Yep.
be putting on the website. We're working on this evidence-based weight management support group on Facebook that we're going to be opening up. And that's
Yep.
going to be to specifically connect about the overweight and obesity crisis, as we feel that there's not enough evidence-based support out there, and there's a real need. I am open to consulting with clinicians who are interested in expanding their practice to include lifestyle medicine, or talking to them about experience with any of these areas of lifestyle medicine pillars. And in order to connect with me, probably the best way is through the MRF Institute Facebook page. DM me. I'm an active contributor and clinician voice there, or send a message through the website, the MRF Institute website, and it can get to me.
All right. So again, thank you so much for being a guest on the show, and it'll be the first of many times that you're a guest. I really look forward to building on this conversation. So thanks so much, Sheila. I really appreciate it.
You're welcome. Thank you.
Do you need assistance in connecting with a fitness professional in your local area or virtually to add this connection to your patient services? If so, please email mrfinstituteorg@gmail.com. Please also remember to check out mrfinstitute.org for information on how to learn more about the education we offer and to stay current with our podcast series. Thanks for tuning in, and we'll see you in the next episode.